Hey, we're Koifly Creative, and we're obsessed with all things production, marketing, business, and helping you navigate the life of a creative leader. We're here to unveil the more unexpected aspects of leadership. We don't stray away from the real talk. We go through it all with influential leaders from all walks of earth. So, pull up a seat and have your morning coffee with us. This is the Morning Cast.
Good morning.
Welcome.
Hey there.
Welcome to the Morning Cast, everyone. Does everyone have their
Welcome
coffee? No.
I have my
That's part of
sparkling
what we do
water.
Interview.
Yeah. How you guys feeling?
Good.
Feeling good.
Yeah.
Quarantine is kind of kicking my butt. I was really good at working out for the first couple weeks, and now it's tough.
Yeah.
It's been rough.
Getting there. What day are we on?
Who cares?
Well,
True.
No idea.
5,000 maybe.
Yep.
But
I have no idea. It's been very interesting remote working and doing all of that, though.
yeah.
I feel like we're more productive. Like we're all very focused, you know?
I am.
Yeah. I do agree with that. I think I was just saying this morning to my sister, it might be weird like transitioning back to normal life after this, you know?
Whatever.
Like, what
normal
is that going to look like?
life.
Yeah. Yeah. Like commuting again, driving.
I hate driving.
Don't know how to do that.
Nope.
I'm going to forget how to
man.
talk to people. Like, how do I interact with people?
Mhm.
Yeah.
Do you shake hands? Is that no longer a thing
No, that's
ever?
a faux
Just
pas.
like do a little wave.
I heard the curtsy's coming back.
You,
Oh, good.
you really have to
Elbow
do like
bump.
Pocahontas.
Yeah.
You know how she does it?
Just like that.
Yeah. I'll do my research on Disney Plus tonight. Don't worry.
Thank you. Thanks.
Anyway, who's up today?
So I'm up. Yeah, I interviewed one of my best friend's moms, who is a nurse at an inner city hospital. And I mean, for as long as I've known her, she's been one of the most level-headed people I've ever known, and can just put things in perspective really well. So I thought it would be interesting to talk to her to see how the virus is affecting her patients, but also her industry as a whole. So I think she had some really, really cool insights. Yeah, and I hope you guys enjoy the interview.
Cool.
Sweet.
Excited.
Oh, we should introduce ourselves real quick.
Yeah.
I'm Shelly, and my goal is to drink a lot of water today because I'm dehydrated.
I'm Dave. That's it.
I'm Erin, and my coffee's kind of cold right now.
I'm Carter, and I drank all my tea, so we got sparkling water.
Fancy fans. Cool. Well, let's get started. We will we'll throw on the recording that you did for us, Erin, with your interview. What made you want to interview her, by the way?
I think, just knowing her background, she has a background in, she's on, I think, the infectious disease team. She says the correct term in the interview. So she was on the Ebola team that her hospital sent out. So she's seen, pandemics before, but nothing to this scale. And I was just really interested to hear her perspective and to see, how it was affecting her personally and professionally. Yeah.
Very cool.
Well, looking
Let's get
forward to
started.
it.
Cool.
Awesome.
Okay.
Thanks, guys.
See you guys soon.
See you soon.
Bye.
And roll it.
My name is Nicole, and I'm a registered nurse in a inner city emergency department. I've been a nurse. This June will be 17 years. So my background is emergency medicine. I spent 1 year working on a med surg floor and 17 years in the ER, and 5 years and 10 months of that in a leadership role. I would say for my department, I can't speak for the whole hospital, but for my department, I think I started hearing people get scared. I mean, I know myself personally I was watching this like fall out in February. And then the first week of March, I said something to my boss, like, you really need to talk to the team because people are starting to worry. And, there's like this oncoming storm you see coming, but you don't know when it's going to hit. But I'm also part of the decon team, and I feel like I was that way when Ebola was taking off. And even though the idea that it might hit our shores or may never hit our shores, it was like that need to prepare just in case.
Wow. Would you consider this to be on the same level as Ebola or a different level, or how would you compare the two?
I would say a different level because we didn't see, like, Ebola never really got here. I mean, I know there was a couple of nurses that got sick. I don't remember exactly where they were from. Texas, right? I think so. And then there was a doctor, and then people that we flew from Africa over to the States that they treated in Atlanta, I think. So no, not the same, but that was the first large scale training operation that we really, really like prepared for, aside from like chemical or radiation.
Just walk us around like what a typical day would look like for you.
So a typical day, especially for most of the nurses coming in, we have to get from the parking garage to our time clock, and that started this past Monday. They've changed the process of which we enter. So now we have to text COVID-19 to this number, and it sends us 5 questions, and we're answering, do we have a temperature? Do we have a cough? I think it says a new cough or a new sore throat, because allergy season, it's very hard to weed out who has what. So they're really looking for you to, stop and think about your symptoms before you come into the building. And we all have to filter in one entrance door now instead of like coming in our separate area. So that's going to be taxing, which I'll do tomorrow for getting to the time clock. After we swipe in, we huddle. We huddle at 7 a.m. and 7 p.m. And it's just a board that used to be the down and dirty, 2 minutes or less. The charge nurse gives off report to the team coming in. Management is sometimes there depending on what their day or their week looks like. And it used to be just the down and dirty of like how many patients are waiting in the waiting room, how many are waiting to get beds upstairs, how many possible nursing holes or tech holes we have, how many psych patients we have in the ER, how many psych patients we have in our psychiatric holding area. And then you could also like discuss, hey, we ran out of blankets, we've called for them, or all of our pumps are broken or something. You could talk about a medication change that day. So it's to give the down and dirty things people need to know in the minute. And now it's changed because that huddle board is about 20 minutes long. Management tries to be at every single one. And it's because the changes every day of what's happening, what we're anticipating will be happening. We've been seeing COVID patients, but not to what they're saying is coming. Like we have the FEMA tent set up out front. Well, it's our tent, but it's a white tent. It's to hopefully do more like the walking wounded, the ones that are going to be coming up with the symptoms. They look punky. You could tell they have like flu-like symptoms, but they can be discharged home, and then save the actual emergency rooms for the people that really need assistance. The strange part is probably the ending of March, or the beginning of March, the ending of February, beginning of March. We were still seeing, our patient care numbers range from 175 patients a day to about 230 a day, depending if we have a busy day. And it's nothing to have 3 to 4 hour wait times to see a doctor. You're at triage for 3 to 4 hours, 6 hours during flu season, because we'll end up with 20 some patients boarding and waiting for a bed upstairs. And right now it's like a ghost town. We're seeing like 78 patients a day. A quarter of them might be COVID patients, but they're really sick, or they're just like the walking wounded, like I said. So we're all on edge waiting for it to change.
Wow, that's intense. Do you really like, what would be the time frame, do you think, when it would?
They said the week of April 11th it's supposed to start, so any day now. And things like we got an increase in pay, they got disposable scrubs, the tent was put up out front. There's things that are being put in place that lead you to believe, the ending of last week, I was like, it's just so mentally draining for everybody. I'm like, oh, we got to be at the end of this. And then you see them installing doors on rooms that only had curtains, and you're like, oh, okay, wait a minute, we haven't even started.
Wow. Oh my gosh. I was completely under the impression that this week would be the worst week, and then it would.
We just got an email today saying Hilton is offering free hotel rooms starting April 13th to the end of May for any healthcare provider that doesn't want to go home, because they don't want to bring it home.
What can people do, like people who aren't in the industry or aren't in the healthcare industry? What's the biggest thing that we can do right now to help you guys and to just help the world?
I think staying home. I mean, it sounds so cliche, but I know for a fact that people are posting pictures with other people. They're out having fun still. I'm not saying people shouldn't go for walks, because we will go insane if we don't get out. And I think we'll get fat and unhealthy, which is a whole nother issue. I mean, we joke because I know I'm eating and we're all eating, but like that's another issue all unto itself. Like how many people are avoiding the hospital and they have major health issues, but literally staying home, washing your hands. And I think finally putting out there wearing a face mask is really a good thing, because we wear those paper masks at work to protect the patient from us. So that's hopefully preventing me from giving something to the patient. Obviously I'm not actively coughing, sneezing, having a lot of like symptoms or anything happening under that mask. But when we're shopping in the grocery store and that poor cashier is ringing you up, like it's better for them if the customers are wearing a mask. I see people with gloves on, and I know we make fun and it's like a joke, like, oh, people are wearing gloves everywhere. But I think people are really scared, and I feel bad because people are making fun of people, but they're scared. And I think people need to know that to like correctly wear gloves in a store, you'd have to bring like 3 pairs. You'd have to put a pair on when you first get there and say you touch the cart and you head straight to produce. And then you get all your boxed items or your bagged items. And then when you get to the checkout counter, you'd have to discard those gloves to get another pair that you're going to use after you've loaded up all your groceries, another pair that you're going to use, take out your wallet and your credit card and then to pay and then bag up your groceries. And then another pair if you're that serious and scared to wash down your purchases. Because I know nurses are even washing their groceries. But I just feel like hand washing, don't touch your face, wear the mask, don't touch your face. And then the second you get out of the store, wash your hands. I wash down my wallet, I wash down my phone. Soap and water works. It doesn't have to necessarily be straight up bleach or something, but the mask, hand washing, and staying at home.
Right. Yeah, that's huge. That's really huge. Would you guys say that, I know some hospitals are starting to accept handmade masks now. Is that something that you guys are doing and you would be willing to do?
They said not yet, but they've accepted the donations. We've got them stored. Like nurses have them in their lockers. Some people are wearing their own homemade masks only because they're saying the paper mask is irritating their skin. I'm not really sure how true that is or if they just want to wear the homemade masks. But the paper mask to me stretches out farther unless you've got one that's wrapping around your chin and going around your ears. But again, it's not filtering out the actual COVID particles, the actual virus that can spew in the sputum. And if somebody is coughing actively, it would still go right through that.
Okay, interesting. Yeah, and I remember Jordan was telling me the difference between the N95 masks and just the paper mask. Can you maybe explain that a little bit?
So the N95 mask is, first off, it's fitted to your face. So we don't just get an N95 mask and put it on. We go through a fit test process. It's usually like 10 to 15 minutes, but because they're trying to get through so many nurses and doctors and techs, it's almost like 4 minutes. But they use there's like a mist in the air. It's almost like an aspartame. You could taste it. It's very sweet and it stays in the back of your throat if you smell it. So you put the mask on and that you're sort of leaning into this mist that's in the air there. And you're doing a series of, you say the alphabet, you lean your head forward, you lean side to side. Sometimes they have you bend over and bend back, but this goes on for several minutes and the machine is measuring how much of that particle actually gets in there. But you can actually taste it if you're not passing. You're actually smiling under there, you're having a conversation, and then you either get a pass or fail. And if you fail, you can try again. You can readjust the straps. You can make sure you're pressing down on the wire around your nose, that you're sealing it really tight around your face. That being said, you put it on and then you go into a patient's room. You use those masks for tuberculosis as well. So I've used those masks through my whole entire career. But you go to use that mask and the second you get in that patient's room, you're wondering, did I seal it right? I don't know if I sealed it right. I mean, it's just in the back of your head. I don't care who you are. Nobody wants to breathe as if that's going to stop it from coming into your mask. Nobody wants to breathe because everyone's thinking, did I seal this correctly?
Oh, wow, that's so scary. I didn't realize that it was that intensive. No wonder that it's crazy that people are actually hoarding these and
well, they're walking around with a different mask. The ones I see people wearing that's an N95, it's one for using, I think for sanding their houses. Not that I'm saying a healthcare provider couldn't use it. I don't know how that would apply because I feel like I'm fitted for my mask and I still don't know if that's working. It's like you're fitted and you're fitted tested every year. So if your face changes, if you gain or lose weight, you should know whether or not it fits. And men can't have a beard. So facial hair will impact the N95 mask. So right now, everybody's clean shaven, which is hysterical. I've seen doctors and nurses that I haven't seen their face without hair in like years, and now everybody's shaved. And when you see somebody walking around the grocery store wearing an N95 mask with a full beard, you're like, no, that ain't working.
Not gonna cut it. Nope. Oh man, that's crazy. This is very timely, actually. So you're right. We should discuss that real quick.
How I finally got my online curb order for booze.
Yeah.
So what do you have to do if I needed a little restock of my booze counter? What do you have to do?
So there's a list of stores that are offering it that you have to find, and then you find like the ones that are closest to you. And I just stuck with one, but you could try multiple ones if you have them. And they give you the number, and you call. And it took me 20 phone calls to get through because it was busy all morning. And then they finally answered, and they just tell you there's like a 6 bottle minimum or maximum per day per person. And you place it, they check to make sure you've got it. If they don't have it, they offer like, we have this instead. Then they give you an order number. You have to give your name, phone number, and credit card. And they tell you when it's ready, and you just pull up, and they'll bring it out to you in a box. But it took all morning.
Wow.
When
Do you have
did
a
you
scheduled
start
pickup
calling?
time? Sorry, gotcha.
When did you start calling this morning?
Like right at when stores opened, like 9.
And it still took you like 20
And it was
calls.
busy until 11.
And this isn't like the first day or two that it's
No,
open.
it's been available since Monday.
Wow. Well, I'm really happy for you.
Thank you.
Yeah, that's really exciting.
Yeah,
That's
no, now I can finally rage by myself this weekend.
Yes. We love a good solo rage.
No, the thing is,
No.
on the weekends, my dance card is really full because everyone's doing Skype happy hours and Skype parties. So, like my Saturdays are like more crazy than they've ever been because people are like, well, we want to play games on Skype, or like we want to have a happy hour. And it's like, wow, guys, I can only do one thing at a time. I have to turn down
Very
parties
busy
now. This is
person.
new for me. I haven't done that in years.
That's so funny.
One of my really good friends, she is she might actually be listening. We'll see. Hi, Elizabeth. She is so she just like can't stop, won't stop when it comes to social events and hosting. And she was in my wedding, and she like took it by the reins, and she's just great. I asked her a couple nights ago if she wanted to do a little virtual happy hour, and she's like, oh, I totally would, but you're gonna make fun of me. I have a virtual happy hour literally every night of the week this week. I was like,
I love
maybe.
that. Like, I admire that.
I'm like, of course she would be the one to overbook herself with like social entertainment during quarantine.
That is so funny. Oh,
I had one
dinner.
drink this week, yesterday, because my dog got loose and she was crazy and I needed it.
Yeah. Yeah.
Well, it's a 6 bottle. It's also a 6 bottle minimum. So I bought 6 bottles. So hopefully I'll be good for
Until the next quarantine.
until the next quarantine. Yeah.
Fingers crossed. Well, what do you guys what do you think of the interview so far?
I think it's really interesting coming from her perspective, since she's seen pandemics before. I remember when this whole thing started, my mom was in the same situation, but during the swine flu. And when this started, my mom was like, oh, you know what? I was on the front lines of the swine flu. Like this, it's going to be fine. And like her song she's changed her tune since then, like she's not as fearless now. And like, she knows like these people are going through what she went through times who knows how much. It's all the more serious. Like she has to text COVID to get into the building. Like that's the measures that they're taking, while important, I mean, it shows that like this thing is serious and these people are there dealing with it every day. It's brave and scary.
Yeah, I had no idea that for the N95 masks, they had to each individually get fitted and like
It's
tested. That's
intense. It's a process.
crazy.
Yeah, I had no idea. And I think she was saying they only usually get fitted like once a year, and like your face might change during that year. And so, her like fears of, when I go into these rooms, is it working? Like, I'm scared to take a breath. Like, that just hit so hard. It's like, she literally is nervous to breathe doing her job, which is, it's so scary, but it also makes what they do so much more, heroic.
I know my face changes a lot, just month to month. Sometimes it's really fat, sometimes it's not. So
Depends how much you indulge.
yeah,
Well, I mean, yeah, and even having to be like
beards.
I'd have to shave my beard.
He shaved his beard last week, and it was the first time I've seen him with a shaved beard in like, I don't know, 6-7 years.
Wow.
Maybe more, 8 years maybe. And I was like, looks great, honey.
Who is this man in my house?
Yeah, he's all of a sudden really like prickly.
Yeah. I also found it really interesting how she is also looking at the long-term like health effects that aren't necessarily related to COVID, but she talks about, like being overweight or like the like mental health effects that quarantine is gonna have on the long term, and how people who have pre-existing conditions are scared to go into the hospital right now. What does that mean for them, and what do their lives look like right now? So just the awareness to all of it is really interesting.
Even imagine like all the people, let's say, that might like feel a lump or something like that in their breast, or like feel something, or have this like weird cough that isn't going away, and they wait to go to the hospital because they're told not to go to the hospital unless it's an emergency.
Right.
And instead of catching a cancer at stage 2, they wait months to go to the hospital, and cancer is already at like stage 3 or 4. Like, that's what I'm so afraid of. And especially because like we all have older parents, like, well, not old. They would not like that if I said that, but ages that they are more susceptible to a lot of these things. So like, what are we missing that we would catch normally, and how is that going to affect us a year, 2 years down the line?
Yeah.
I have a question going back to the mask. Like for the N95 mask, can they wear like a second different, just like a regular mask over top of that?
Yeah, a lot of them wear a paper mask over the N95. I don't know if this gets addressed or not, but I know that it helps because it helps to cover that mask so they don't have to worry about that mask getting contaminated as well.
True.
Right.
I also love that. I love the question you asked her, Erin, when you asked, what can we do? Like, how can we help her, and how can we help the whole situation? And it was interesting that she said to wear masks, to the grocery store or anything like that. Because I think, Carter, you have it, I think I either sent to you or you sent it to me or something, but there's this post that was going around talking about how masks aren't necessarily helping you, but they're helping not transfer any type of germs or bacteria or viruses to someone else. And it's even more beneficial if both people are wearing it. Like, do you have the...
Yeah, so it's probably backwards here, but so it says if a COVID-19 carrier is not wearing a mask, the contagion probability of giving it to someone with a mask is 70%. And you could only imagine, it's probably 100% with both of them not wearing masks.
So if I have COVID and I'm wearing a mask, it's still a 70% chance that I'm going to get it.
If you have COVID and you're not wearing a mask, and Dave is wearing a mask, there's a 70% chance that you could give it to him even though he's wearing the mask. And then, so if you are wearing the mask and Dave doesn't have it and he's not wearing a mask, there's a 5% contagion probability. And then if both are wearing a mask, there's 1.5% contagion probability. So that's just like crazy.
And it's important to remember that this can be asymptomatic in a lot of people. So like everyone should wear a mask.
Wear it. And
Get
also
a
like the
fashionable
whole
one, get a
thing,
cool one.
yeah, there's like, and the whole thing with the gloves through the grocery store. I didn't like, I know like I don't wear them just because I know that, you know, you would have to change them out, but I didn't realize how many times, you know, she was talking about changing them a couple times.
Right. Just like basic, like the basic info, I feel like, I mean, I didn't know any of this, and I think it could be so beneficial if this was more, you know, basic knowledge that we could get out into the world. It's like, if you are going to wear gloves, like do it properly, and this is how you do it properly. But it was really insightful to me.
Yeah.
It's even things like I use my phone for my grocery list. You know what I mean? So if I'm using my phone for my grocery list, that is cross-contamination right there. If my mom calls me, I put it up to my face, and then like nothing I did even mattered, you know? So lately I've actually been like writing out my grocery lists so I can just throw out the piece of paper and not touch my phone. And then I have, you know, Clorox in my car just to wipe down my phone and wipe down everything before I go inside. But like things like that it's good that people are trying and people are, you know, taking measures, but I feel like as a population, we're just not fully educated on.
I mean, have you seen that picture of the guy at the Target he's wearing a glove, he's got his phone in his hand, and his other glove is dangling out of his mouth while he waits for checkout? I mean, people, like, you just have to be like, if you're going to do it, you have to be cognizant of what you're doing. You know, it's
very mindful of all the steps and everything that you're doing.
Yeah.
That's crazy. Yeah. Well, I was super pumped for part 1. That was really good, Erin. I'm excited for part 2.
Yeah.
Awesome. Yeah, let's dive into the second part. I'm excited for you guys to hear it.
All right, and roll it.
I mean, to contrast that, have you seen any or heard of any really incredible stories of hope?
Yeah, so they did tell us that, you know, I don't work in the ICU, and I imagine that's probably even harder because, you know, we see patients and we can see whether or not they're unstable or if they're stable, and then we stabilize them, and then the ICU swoops in and takes them upstairs. So, you know, if I see on my shift 2 intubations and then the shift after me sees 3 and the next day I'm off and they see 4, you know, I don't know about all them, and they're up in the ICUs and they're the ones really, you know, dealing with the long-term, you know, trying to get those people off the vent and trying to make sure they get better. But we did hear that, you know, they had a success story of extubating a patient. Extubation is when they remove the breathing tube. So, you know, we were told of a story where they had extubated somebody that they had intubated pretty early on, and it was a younger person. So that is always a little terrifying because we're hearing, well, we wrongly heard in the beginning that it was an old person virus, which I don't think they should have ever told that from the get-go. It should have been, it's a virus, because I think that made people think to take unnecessary risk. But I feel like as they have these success stories, they're going to need to tell them, and tell them often, to keep people working in healthcare, you know, feeling that what we're doing is helping.
Why do you continue to do what you do, basically?
Well, I mean, I love being a nurse. I love helping people. I mean, it's what I do. I don't feel like, I mean, it's almost a little awkward when people are thanking us because I feel like we're just doing our job. I don't feel like we're doing anything above and beyond. I know this is like a deadly virus, but I do feel like I signed up for this. So when people are like, I didn't sign up for this, I feel like I did sign up for this. And, you know, to be there at someone's lowest point or their most terrified point is why we do what we do, to see them out the other side, to see them get healthy and get well. You know, I feel like the heroes are these young kids still going into Walmart to work and the grocery store, and these truck drivers working their butts off to get the supplies where they need to go. I feel like that's like above and beyond. You know, people still working at Target that could be like, you know what, I don't need this job.
Exactly. No, absolutely. It's incredible how overnight, like, it's separated into essential and non-essential workers, and everybody's lives are just like, you know, everybody's like scrambling, like, what is going on? Is there something specific that you're really nervous about on a personal level or on a professional level in any way?
Well, it's funny because I don't think I'm scared of necessarily taking care of people with this virus, only because I feel like we're trained to do that. And I feel like we've been trained well where I work. like I said, the fear is always in the back of your head when you put that mask on. Did I seal it right? Did I seal it? Did I press down hard enough? Is this really, secure? I fear what I might see in the next coming weeks. I fear like the emotional toll that it might take. And I fear bringing it home. That's probably one of my biggest fears, is bringing something home, because I would never want to make my family sick. Now, I haven't seen anyone outside of my immediate family that lives in this house, and we follow crazy steps to try but it's like you're sitting at work and you're like, it could be on this it could be on this keyboard, it could be over here on this phone, even though you wipe everything down, but you can only do so much before your OCD like starts to really get crazy. You try to only touch the front of the car, and I'm used to pulling the end and, just like leisurely walking. Now I'm just want to get in and get out. And I like to drink water. And so the idea of putting on that mask, that the personal protective equipment, we all know in this country right now is bad. Like it's bad. Like there's a fear of, running out. So, we're trying to be judicious with what we have. So if I put on that mask and I'm taking care of a bunch of COVID patients, I don't want to take it off, because I want my seal on, and that mask is not comfortable at all. It cuts into your face after several hours. But I like to drink water, and I'm like, I'm afraid I'm not going to have water for hours. And that is like concerning.
Yeah, absolutely. I mean, how long is your shift? Is it 12 hours, 8 hours, 12 hours?
12.
12 hours. So, essentially it's 12 hours without water.
It depends on where you're at. Usually we change assignments twice a shift. So if you could be in the same assignment for 4 hours, and then you'll move and do 8 hours somewhere else. So at that point I could take it off and change. It depends on how bad it gets. But I also wouldn't want to switch out of my assignment if the person coming in was pregnant or older or concerned. I would just stay in my assignment. I would just tell them I'll switch, because my coworkers are scared. There are some that are more scared than others, but there are some that are terrified.
Wow. Yeah. And you've been in a leadership role as well. And so do you feel the extra responsibility to be like, if my coworker is pregnant, or if they are really, really scared, like, do you feel like you have to personally take that all on?
I feel like that just as a nurse, as a coworker, as a decent human being, not so much as somebody that was a leader in that role. But I do feel like, you're constantly hyper vigilant of everyone around you. Like, oh, you touched your mask. Oh, don't move, and we're calling each other out, which I think is good. And I think we need to keep doing that, because you're unaware of how many times you touch your face.
Yeah. That is so true. Oh, wow. That is, it's so great to hear that you guys have each other's backs, and it's like, this is really the time to lean on each other and to stick together. And, that's really refreshing. What, if you could give a message out to other people, to people who don't work in the healthcare industry, what, besides, staying home and listening to the CDC guidelines, is there anything else?
I would tell them not to lose faith. Like, I think that, it's scary times for everyone. I think some of the scarier things is we don't know everything about this virus. Like, we keep hearing like the respiratory, the ventilators, this and that, but, they're finding things that it impacts the way our blood clots. They're finding that it impacts the kidneys. And, I think being home, trying to maintain your own anxiety, think about your health, get out there and walk in the sunshine, get out there and take care of yourself. Don't just sit home watching the news all day long, because it's really going to make you bonkers, and you got to take care of your mental health and your physical health now more than ever, I think.
Yeah, that is so true. I saw a statistic. It was one of the models saying like the suicide rate could spike in the next 6 to 9 months. Like, it's so disheartening. And I think, if people go outside, thank God the weather's getting nicer. Like, as long as you're responsible and you're smart about it and you're staying away, I think that's really actually going to save lives here.
Correct. I think, when I heard at first that they were closing parks and stuff, I think they were talking about like the monkey bars and jungle gyms and stuff like that. But I thought they can't close the trails and the pathways, or people have nothing to do. Like, people have to be able to go outside.
Right.
Because the sunshine is so therapeutic.
It really is.
I think people, I do think that the majority of people are good and trying. Like, they're trying to stay at home, and they're trying to follow what they say. And like I said, I went to the store today, and I'd say 90% of people had a mask on their face. So I think people just wanted permission to wear the mask too, because I think people were scared to go outside, and, hearing it on the news, like it's okay to wear it, they felt like, now I'm authorized to put this mask on, which is good. I think just constantly taking care of each other. I worry about the longer this goes on and how it impacts the economy. I worry about how people are eating, how they're affording food. I worry about those kids where school was their only outlet for normalcy, those kids that are in homes that are so broken. So I think we have to be a little more vigilant to worry about our neighbor next door, or the little old lady down the road, or that family of 7 that maybe is struggling for food, because we all have a little bit to give, I think. I'm really impressed with how our school district out here has been putting meals together and feeding people. Like, they're putting together packages and food, but it was disheartening the other day. Somebody had posted that by the time they got up there, they had run out and all they had left was snacks and juices.
Wow.
And it's like, what are those families going through? And I think that the increase has come because this unemployment is going on longer than planned.
Yeah, I think it's crazy. I mean, 1 or 2 weeks was definitely expected. I think once we realized it was going to be here, but like now hearing people, June 1st is starting to come up again and again. And I'm like, that would be like 2.5 months essentially, right?
And I'm thinking that it hasn't even, I feel like 2 weeks ago, we weren't even in the running. And I feel like now is when we're going to start seeing the sicker of the sick, and it's going to be really important to quarantine and stay in and remain vigilant about everything you're doing at home, because until it either hits or we're told that peak has passed, it hasn't even started, which is, I mean, for here, obviously New York City is, but you hear that like North New Jersey, and you're hearing like it's slowly coming down the pike.
This is all like really, really important information, and I really appreciate you doing this with me.
But we're good. We're very blessed. We're very fortunate. Right. And I mean, to be honest with you, I'm happy to be able to go to work and do what I love.
I'm just going to jump in and start recording.
Yeah.
I think you did a great job.
Thank you.
Reiterate. And she's badass.
Isn't she? Like, she's like the coolest person in the world.
Yeah.
Yeah. I really think that she has a very healthy outlook on everything, and it seems like, she didn't say it, but it seems like she's kind of going through the motto of she can control what she can control, and she can't control anything else, and she and she's only doing things to help what she can control. And I think it can be very easy to get panicked and very afraid, but it seems like she's pretty level-headed through all of this.
Right. Exactly.
And she's well-informed,
Exactly.
I mean, obviously she's well-informed, but like just the whole, like, they shouldn't have said this is an old person disease. Like, that's probably what caused the mass spreading of it, because the young people thought they were immune.
Yeah.
And that's not the case.
Yeah. And she's very real about the whole thing. It's like, these are the facts. These are what we know. This is a very fluid situation. Like, this could change, as it has since the very beginning. And I think, like you said, Shelley, like, she's just very level-headed, and, it's like, we're going to do what we can do right now.
Yeah. I think one of the biggest things that I took out of at least the second half was, and kind of the first half too, was just the repercussions of what we're doing. Like, the first half she talked about, like, we're not getting out as much. We're all probably gaining a little bit of weight. We're not eating fresh vegetables all the time because we're not going to the grocery store. We might not be catching all of the cancers and diseases that we would before because people don't want to go to the hospital. And I think on the back end of the interview, she was talking about, at least it reminded me about all the people who have mental health problems. And I just saw a statistic the other day that, domestic violence has gone up like crazy because people are lonely and they have lost their jobs, and it is very stressful, and money is tight. And those are all, and if you can't leave your house, those are all, it's kind of like a, just everything that adds up is increasing domestic violence within families and within homes.
The perfect storm of stress and
right,
everything.
Mm-hmm.
Yeah.
I also thought it was crazy how she mentioned how they can't really drink water when they're on their shifts. I didn't even think about that.
Mm-hmm. Yeah, just like the fear of having, like, even just taking your mask off. I mean, using your hands to touch your mask, and then, you know, it makes you think, like, do I really need this water right now? And obviously you do, but it's everything you're second guessing.
What I really appreciated her point of view from a leadership standpoint, and I'm glad that you kind of addressed that, because you know she's the kind of woman that you would want to be leading your team, because she does have that level head, and she does obviously care about the people that she works with, which is it's nice to hear that kind of story, you know, like of selflessness. Like, hey, if this person's really scared, I don't want to leave this post. I'm going to keep on doing it. And it's like little stories like that that kind of can make you appreciate what the extra effort people are going through.
Yeah, absolutely. And I love the fact that she said, you know, and everybody's story is very different, but she was like, I do believe that this is what I signed up for, and I'm not going anywhere. Like, this is what I'm trained to do. That was really, really admirable.
Badass.
Yeah.
Thank you for doing that, Erin.
Yeah.
Thank you guys for listening. I'm glad I got to talk to her, and hopefully this helps other people just with some information about it.
Yeah. We need more conversations like this.
Mm-hmm.
Thank you, Nicole, for all you do.
Yeah.
Keep being a badass.
The best. We love her.
Word for the day?
What'd you say?
That's Dave's word for the day.
Yep.
Badass.
Badass.
It's very accurate.
Elko accent, man.
Awesome. All right, guys. Thank you so much. I really appreciate it.
Thank you.
Guys.
Well, I'll talk to you guys soon.
Stay well.
Stay well.
Thank you everyone for listening to today's morning cast. We loved having our morning coffee with you. Make sure to subscribe on YouTube, Spotify, and SoundCloud, and turn that notification button on to make sure you don't miss any episodes. Until then, keep hustling and pour yourself another cup of joe.